This is, unfortunately, the crisis that we feared.
That was Peel Region Medical Officer of Health Dr. Lawrence Lowe back in April, when the diverse populous region near Toronto was a nationwide COVID hotspot with a 22% test positivity rate and hundreds of people in ICUs. Today, it is a very different situation. Peel Region has a high vaccination rate and about 1/10 of the COVID cases it did a year ago. So how did they do it? A huge effort by regional health officials and a grassroots campaign turned things around dramatically. This video advocating masking is one example, part of a community-led push to inform people about COVID protocols and advocate for vaccination. Joining us now are three of the people behind that effort. Dr. Hashim Khan is co-chair of the Canadian Muslim COVID-19 Task Force. Heer is that organization's outreach lead. And Dr. Grewal is the co-founder of the South Asian COVID-19 Task Force. We will start with you, Dr. Grewal. Let's talk about this initiative and why it's so important to you.
Thanks, Asha, for the question. Well, it was about a year ago, and, Dr. Hashim Khan, who's on this call right now, he reached out to my wife and I, and this was back in November 2020 around Diwali, when COVID positivity rates in my hometown were well over 20%. And he said, Raj, Peel is on fire. We've got to do something here. And this is where my mom and dad still live. Like I said, I'm from there. South Asians make about a third of the population of the Peel region, but we're making up half of the cases. And so South Asians were being disproportionately affected by COVID-19 due to the essential workers. They didn't have that option to work from home. And they came from multi-generational families. One person got COVID-19 in the home, they all did. So there was that lack of cultural sensitive information also being available. So we knew we had to do something.
Mm-hmm. And Dr. Khan, you came up with an approach specifically for your community. What was different about it?
I think what we saw was the pandemic doesn't affect, it's not just a medical problem or a health problem, it affects communities, and there's spiritual aspects to it as well. So what our task force has been doing is we've tried to have a holistic approach to vaccine rollouts as well, where we have faith leaders as well as community representatives along with healthcare providers and physicians. And collaboratively working together, we came up with a strategy where, first of all, we reviewed the contents of all the vaccines, made sure that they were permissible and halal, and came up with statements with organizations to endorse vaccinations as a social responsibility for all Muslims, as our responsibility to all Canadians as well as our own individual responsibility as well. And then we had faith leaders as vaccination champions along with Muslim healthcare workers, so people who looked like the community members as well who were getting vaccinated to inspire confidence. We want to inspire confidence and hope before hesitancy actually set in. And beyond that, we wanted to create safe spaces. So we promoted and supported mosques as vaccination clinics and sites. And we had access and channels where people could ask their questions and we would answer them and distribute the answers online along with to 500 mosques across the country.
You're the outreach lead, of course, at the Canadian Muslim Task Force. On the ground, as you talk to folks, did you encounter a lot of vaccine hesitancy, and how were you able to overcome that?
Well, there wasn't a whole lot of vaccine hesitancy. However, because it was, we had launched at the Islamic Center during the month of Ramadan, people were fasting, and some people had concerns around getting their vaccines during their fast, and people didn't want to break their fast. It's very important to the community. So we had to have faith leaders, community leaders champion that, host sermons in regards to that. While making calls, some people did express if this was okay, if it was halal, and we said that yes, there were imams and who said that there's no issue with having a vaccine while you're fasting. Aside from making phone calls, text messages, we also went to the doors to talk to people. We didn't want to miss anyone from the community. The Brampton Islamic Center was in a hotspot, one of the hotspots. And so we wanted to make sure the community knew that the mosque was a vaccine clinic, which set a great example as a leader in the community, to also say that it's okay to get vaccines during Ramadan. And, while at the doors, we also, had volunteers that spoke various languages. So just in case somebody needed to feel a little bit more comfortable speaking in their language, that also helped as well.
Yeah, you touched all bases, covered all ground. Dr. Grewal, your organization had great success connecting with the South Asian community through social channels, social media, and the like. What did you do to reach out to people?
So we created, social media infographics in multiple languages from our task force. We created videos acting out reliable or sort of relatable skits that really resonated with our community. I started making, videos in Punjabi on how to book a COVID test because our community wasn't booking tests, or that was one of the barriers. So thanks, Mom, for teaching me Punjabi as a kid, because that really came in handy. And how do we get this information out? We got it out through non-traditional channels. Our community was using WhatsApp to get information. The uncles and aunties in my community in Peel were using WhatsApp, so we decided to, one day I woke up one morning and I said, you know what, we're going to make the South Asian COVID Task Force WhatsApp channel. And we got international students, we got essential workers, we got ethnic media leaders to join our channel, and we were able to get information. And in return, these communities, these individuals, they felt empowered to share their own stories and become community role models and partners with us. I mean, for example, during the vaccine campaign at the vaccine clinic, we had an Uber driver. I was filming him, and he was talking about how important it was for him to protect him and his family. The international health student who wanted to tell me on video that, look, I didn't have to pay for the vaccine. Please come and get your shot. So we really empowered them to be role models.
And you also brought the vaccines to local temples. How did that go?
So absolutely. I mean, we've been doing this since September. We wanted to meet our community where they were. And they were, some of them were at the temples, the community free kitchen and the gurdwaras. And so we've been vaccinating at the temples and have had tremendous success at vaccinating our community at the temples.
Dr. Khan, can you talk to me about just seeing this, overwhelming support and the initiative, and see where it's gone over the last few months to a year, right?
Yeah, I mean, we knew this time last year that vaccines were around the corner, and now a year later we have vaccines, and we're now at a stage where 90% of us have received at least one dose, and 85% have received 2 doses. So I think it really speaks to how everyone's sort of working together. There's public health, there's governments, there's lots of community organizations on the ground that are all collaboratively working to try and get as many people vaccinated as possible, and meeting people where they're at, and with whatever medium that they need, and with whatever trusted voices that they need to have their questions answered.
You went to great lengths to get people to virtual town halls to inform people about vaccination. Can you talk to me a little bit about that?
We had town halls in various languages, engaged with key people representing those various backgrounds. So Urdu town hall, Bengali town hall, Arabic town hall. We had, reached out to ethnic media as well to help us promote our campaign to keep the community safe.
WhatsApp seems to be where it's at. Dr. Grewal, I want to leave it with you, the final word. What can the rest of the country learn from this work? And I understand you started a nationwide campaign, and in fact, you've got the shirt there that says, "This is our shot," and that grew out of your work in Peel.
I absolutely did. I think what we've learned is that in order to help people, you've got to meet them where they're at. And I think Dr. Khan also talked about that, and to understand their needs, and that's to how to gain their trust. We've got to empower communities to role model. We know that every voice counts, and that when we work with our communities together, we can make impactful changes. And that's what the whole principle behind This Is Our Shot is about.
Mm-hmm. Such a pleasure speaking to all of you. Thanks so much.
Thank you.
Thanks for having us.
Thank you.